Good morning. I am Dr. Shankar from Mangalore, Malikatti Neuro Center. I am here with you to share few information about epilepsy, which to a lay public is like a death sentence sometimes when they say epilepsy because of a lot of issues associated with epilepsy and people get frightened. So I am here today to discuss or to share with you a few information about epilepsy. Otherwise called as seizures or fits. Epilepsy, seizure or fit is a symptom of brain dysfunction. Like how fever is a symptom of malaria, epilepsy suggests that the brain is dysfunctional. A epileptic fit could be a minor symptom, or it could suggest a major disease of the brain, like a brain tumor. Now, what exactly happens in epilepsy is there is a short circuit in the brain, just like how short circuit occurs in the pole. Similarly, a short circuit occurs in the brain, and when that short circuit occurs in the brain, depending on which area of the brain is involved, it manifests. If only a small area of the brain is involved, we call it as focal epilepsy. If it spreads all over, then it's called as generalized. Going further, we said that one part of the brain is involved, it is a partial epilepsy. Like let us say the hand area is involved, they may present with jerking of the movement. We call it a simple partial seizure. Or it could spread to the whole body and go on to the patient getting a generalized epilepsy with a cry. This is called generalized epilepsy. So depending on the area where the electrical storm starts, we classify epilepsy into different types. So one, how do we know that a person has epilepsy? Not all patients who faint have epilepsy. Many a time, children in the school, if they have not had breakfast, they have a syncope, fall down and get up. Or some of you, when you come to the hospital, when you see blood, you fall down. It is not epilepsy. Again, there are other causes. So just because patient falls doesn't mean patient has epilepsy. So how do we diagnose epilepsy? In today's world of modern technology, the best way to diagnose is to record when one has an attack and bring it to a doctor. This is the best ever diagnostic tool that we have in today's modern world. Second, we have a test what is called as EEG. We put electrodes over the brain and record the electrical signals. But what one should remember is, if you do an electrical recording EEG when the patient has an electrical storm, you will pick up abnormal EEG. But if the electrical storm doesn't occur during the 20-30 minutes of your EEG recording, EEG will be normal. So just because EEG is normal doesn't mean that epilepsy is not there. And the third diagnostic tool that we use is a CT scan or MRI. This will tell us whether that epilepsy is a serious disorder or a sometimes a provoked attack where we don't treat. Provoked attack means many a time we have people who come with sleep deprivation. They go to a festival, 2 continuous nights they are without sleep, or they go to Dharmanema, Kola, or many of the students, they have the college day or refreshers day, whole night they dance, and sleep deprived brain suddenly throws a epileptic attack. This is called as a provoked attack. If it is a single attack, it is not serious. We don't treat. So whether your epilepsy is a major issue or a minor issue, we'll know by looking at the history and by looking at your investigation. So first of all, we have to decide whether a patient has had epilepsy or seizure. So a clear recording in the mobile will give us absolute confidence in the diagnosis of the event. And second, by doing your test, we'll know whether your epilepsy is a disease that is going on to trouble you through the life, or is a minor, event which we don't have to seriously worry about it. So first, once we diagnose that you have had epilepsy, then what is to be done? Now, if there are more than 2 epilepsies and we are we have confirmed that it is a truly epileptic attack, then the chance of recurrence is very high. In that case, we put you on what is called as AED, anti-epileptic medication. We have about more than 20 molecules with us. We call it as magic bullets to control your epilepsy. And generally the duration depends on between 2 to 5 years, which you have to take without fail. And some in the initial stages, some of you may have some issues with tolerance. So always you get back to us so that we can adjust the dosage or change the molecule, and if it is not effective, we can go for a newer molecule. So it's always a trial and error method that we try to control your epilepsy. Some mistakes that you do is, after you take for few months, then many a time I've seen that the patient wants to try whether it is gone or not. Epilepsy is so slowly on their own they reduce, or they take alternate day. It is not a healthy practice, because you have a major attack, then the time starts from then on for another 2 to 5 years, and efficacy of the molecule also goes on. So it is always better to consult one of us before you try to adjust the dosage. What other things do you have for epilepsy other than medication? A very small percentage, less than 5 to 10%, need what is called as epilepsy surgery for those who do not respond to medication, and that is a very small percentage of patients. I have talked to you so far about what we call as idiopathic epilepsy, where there is no changes in the scan imaging, that is scan or MRI. That means you have no other cause for your epilepsy. That means a sudden synchronized electrical discharge. It's called as idiopathic epilepsy. In many patients, other neurological diseases like brain tumors, blood vessel malformations, infections of the brain like TB, or sometimes tapeworm, these can result in epilepsy. So in these situations, in addition to giving you medicines for epilepsy, we have to treat the primary cause. Supposing there is tuberculosis of brain, we put you on anti-tubercular medication. In case there is a brain tumor, we need to operate and take out the brain tumor. So it depends on the underlying cause of your epilepsy. Now, what are the do's and don'ts for epilepsy? Do's: you lead a healthy life. In literature, there are so many famous people who have achieved Nobel Prizes, who have conquered kingdoms, and despite epilepsy, they have conquered the illness and conquered the world. So you lead a normal life. There should be no, you should not have any hesitation in your mind that will I be able to achieve my full potential in life. Alfred Nobel, who discovered dynamite, was epileptic. Alexander the Great, Julius Caesar, any number of people we have, Pythagoras, any number of famous people had epilepsy. Tony Gregg, Lewis Carroll, who wrote so many literary books. So it's not that you have to hesitate that will I be able to achieve my full potential in life. Yes, you will be able to achieve full potential in life. Never ever miss your medication. You always lead a healthy life. We advise you to have proper food and proper sleep. Sleep and alcohol are the most important two events in an epileptic person. Sleep deprivation suddenly boosts electrical discharge or short circuit in the brain. Alcohol again reduces the threshold, throws a fit. So see that you have a proper sleep and lead a normal life, have healthy food, avoid alcohol, and many a time you can have normal children, you can lead normal, you can have normal office jobs, and you can lead a normal life, a healthy life. One more issue about epilepsy is that traditionally somebody has jerking in the limb. They say he has Brahma Rakshasa. Brahma Rakshasa means he is possessed by demon. Of course, those who have some mental disturbance also can present with some jerking the limb. But epilepsy is a very, very structured event where there is tonic-clonic movement of the limb, there is frothing of the mouth, turning of the eye. So nobody can ever miss a possession from epilepsy. So many times some public people get, they get into a like in the mind, could it be the demon attacking? And many a time innocent children are taken to a faith healer, where in the guise of making money, people try to extort money from them. And sometimes tragedy occurs in the sense that they stop the anti-epileptics and they have major attacks, injuries, and some neurological deficits also occur. So epilepsy is a disease. It is not possession. It is not demon. It is not a Brahma Rakshasa. They are doing their profession. They try to scare you by saying that the demon is possessed your child. But if we are able to, see attack in your mobile and we are very sure about epilepsy, you should not heed to all these faith healers who try to scare you off that these are evil spirits. And it's been there in the earth from centuries onwards, where people who do this try to scare people of the evil spirits. Finally, I would like to conclude, in majority, epilepsy is totally curable and one can lead a normal life. In very few minority who have been having epilepsy since childbirth, who have mental retardation, very frequent attacks, few times a week, their quality of life is not as the average person. So generally when one talks about epilepsy, we relate to those kind of epilepsies. But by and large, it's not a disease that one should be frightened of, and one should not hesitate in choosing their life goals or achievements in life. It's a totally curable disease in majority, provided you follow the advice and lead a healthy lifestyle. And all epileptics should go through the literature, see how the famous people have coped up in the life and take courage from their life and get on with life. Thank you.